then leads on to, well, okay, if it does work, is there a danger that it may be used to pressure doctors and other staff? The idea that rather than tackling inhospitable conditions, dangerous working conditions, that we should somehow just train doctors and other staff in resilience so that they'll put up with dangerous working conditions. And I see this as a myth. And I'm going to tell a story from my own experience and my own interest in resilience training. But I would say very clearly, and it's very much the approach of this training that we're offering here, that resilience can help us both cope with and also improve conditions. And I go further than that. I'd say that improving conditions is an expression of resilience. That if we see resilience as what helps us face, deal with, and or recover from adversity, from difficult situations, then I want to make a distinction here between resilience and endurance, because I think the two are sometimes confused. And so, for example, if somebody's sitting in a very uncomfortable chair, would you suggest giving them endurance training to help them put up with the discomfort? And I think that would be seen to be an unhelpful thing to do, that if somebody's sitting in an uncomfortable or dangerous chair, what's more likely to happen is an ergonomic approach. And ergonomics is really about looking at the design factors that help both comfort and performance. And that what you do there is you'd address the problems with the chair. And I think there's a metaphor here for working conditions. Rather than having an endurance training that helps people put up with unbearable working conditions, that it's better to take an ergonomic approach and look at the conditions people sit or stand or work in. And you can go even further, rather than just addressing the problems with the chair, that you might go further even and redesign the context of the work, or the office of the work, or even the work itself. And so that my own journey of resilience training has involved sometimes campaigning and working and succeeding in making changes in my working conditions, but it's also involved sometimes changing the place that I sit in or work in, and to move to a completely different context. So I'm going to give some practical examples of resilience strategies. And I work a lot with a narrative approach where I'm really asking the question, what does a story of resilience look like here? And I'm going to leave that as a question for each of you listening to consider whenever you're in a challenging situation, to ask yourself, what does a story of resilience look like here? And I'm going to be working with this idea that I love this saying, there's what happens and then there's what happens next. And when we do resilience trainings, and in the 7-module course that begins on November the 12th, we'll look at this more. We'll look at examples of resilience where you can have examples following this story structure. This is a story about the adversity faced is, and then I think there's the downslope of the dip, but resilience is very much about finding the upslope of the dip. How do we climb out of the difficult or challenging situation? And so if you find yourself stuck in a situation where you're in a dip, we're going to be looking at, well, how do you climb out? What helps you climb out? So and one of the things for me is just this story structure, because if I'm down in a dip and I notice that, or I'm facing a challenge, what I focus on is this part, the third part of the story, where I say, what helps me here? What helps here is, and we're looking there at helping factors or helping processes, and they can lead somewhere else, and that's where what happens next is. So I'm going to give an example of that. I'm going to give an example of that story structure, and I'm going to tell a story about me. So this is a story about me. And the adversity faced was, well, I'm thinking back to a time where I worked in hospital medicine, and this is back in some years ago now. Back in 1989, I was a junior doctor and I had a contract for an average working week of 88 hours. Sounds unbelievable, but that was my average. And so some weeks I'd work 112 hours or 118 hours. There even on one job I did some weeks where I worked 135 hours in a week. And people might say, well, you weren't working every minute of that time. That you were on call for some of the time, but I was in busy jobs where I'd be up on my feet a lot of that time. And actually, one of the things that I did in terms of what helps, we actually organised a little workshop to look at resilient strategies for hospital doctors. This was actually over 25 years ago, and the workshop was called Coping Without Sleep. And we looked at what's going to help us when we're hardly sleeping at all because we're in this difficult job. What we found, what we came to the conclusion was that, well, there are some things that will help a little, but basically we need our sleep. And so I took instead a campaigning response. I actually took my health authority to court. And over a 6-year legal battle, I won my case. And the ruling that came out was that if a health authority or hospital works a doctor under so many hours as to foreseeably damage their health, then that is unlawful, because there is a duty of care that employers have to provide a safe system of work. And that the legal situation may be different in different countries, but there are health and safety legislation in many parts of the world. And so I effectively took them to court and challenged my contract and succeeded in that. But actually taking that court case was one of the most testing things that I've done, actually just as testing, or even more so in some ways, than being a doctor. And so I couldn't just rely on the strategy of a court case. I needed to have other resilient strategies too. And I want to tell you some of the things that I found helpful. I went to a talk by a pioneer of the holistic approach to healthcare, Professor Patrick Pietroni, over 20 years ago. And he described this boat and water level metaphor. In fact, it's about 30 years ago I went to this talk when I was still a medical student, and it changed my practice of medicine. And it also has really been a foundational framework for how I approach resilience. So we have times where we're rowing along merrily, and we also have times where we crash into a rock. And a rock is a problem. And one approach to resilience is a problem-focused approach. And that's a lot what doctors do, that when patients come to us with rocks that they've crashed into, we're a bit like geologists. We know all about the rocks that they might crash into, and we have ways of dealing with those. But as well as the rock, there is also the water level. And the water level is a metaphor for our resilience or level of well-being. And you may even think right now, well, what are the things that push up your level of resilience? And to give an example here, that there might be some days where you face a problem where you're at a low ebb, your water level is low. And when you're at a low ebb, you're more likely to crash into a rock. Whereas when you're feeling very well resourced, perhaps you've just come back from holiday, you're feeling refreshed, things are going well, maybe you've had a slightly quieter time, and something difficult happens, you may find that you float over it rather than crash into it. And in resilience training, we're looking at the factors that affect this water level. And in particular, we're going to be looking at strategies, strengths, resources, and insights. And I see this as such a helpful framework. These are 4 elements of a resilience toolkit, and I call it our self-help SSRI. I'm sure many of you may be familiar with those letters SSRI associated with antidepressants, the commonest group of antidepressants being the selective serotonin reuptake inhibitors. And I'm using those letters here to stand for strategies, strengths, resources, and insights. Strategies being practical things we do. Strengths being the inner qualities we draw upon inside ourselves. Resources being, think of them as a bit like roots of a tree. It's our sources of nourishment, of inspiration, guidance and support. And that includes people, but also places, and also maybe self-help books or telephone helplines or counsellors, and also maybe internet resources like resilienceForDoctors.com or our favourite TED Talks. And then there are also insights. Insights are guiding ideas that we find helpful. And so I love this image here of these are our resilience tools. Strategies, strengths, resources and insights. And in a resilience training, we add to those. But a very useful strategy is just to ask yourself, is there a time where I've been through something difficult and I've got through in a way that I feel pleased about? Is there a time I've got through something difficult where I've got through in a way that I feel pleased about? And how did I do that? What are the strategies I used? What are the strengths I drew upon? What are the resources I turned to? What are the insights that guided me? And there's a video about this on the free online resource that you can get a link to from resilienceForDoctors.com.